There is an unmet clinical need to improve upon currently used biomarkers of response to immunotherapy. Tumor mutation burden, which is a measure of the number of mutations carried by tumor cells, is considered an emerging biomarker of response, however, has been imperfect in identifying patients more likely to benefit from immunotherapy. Working with Suzanne Topalian, Drew Perdol, Tony Ribas, and Victor Valculescu, we have combined genomic expression and immune cell repertoire analysis to gain insight into the complex crosstalk between cancer and immune cells during immunotherapy in melanoma. Our ultimate goal was to develop an integrated molecular biomarker that could potentially help physicians predict which patients with melanoma will respond to therapy. In order to understand the molecular wiring of response to immunotherapy, we performed whole exome and transcriptome tumor analysis combined with T-cell repertoire analysis for melanoma patients from the CheckMate 038 clinical trial. The purpose of CheckMate 038 was to investigate the mechanism of action of nivolumab and nivolumab in combination with ipilimumab in subjects with advanced melanoma. TMB alone, again here, did not fully explain the therapeutic responses seen. We found the patients with tumors with a high degree of T-cell infiltration before treatment had a significantly longer progression-free survival. When we examined changes in T cells during therapy, we found that dynamic shifts in the T cell population were also reflective of clinical response. In addition, we found an enrichment in B cells in baseline tumors of patients with a clinical response. Our findings suggest that the complex phenotype of the immune infiltrate is relevant for determining clinical outcome. Ultimately, we combined tumor genomic features with T and B cell features using a machine learning approach to generate a risk score and classify patients in high and low risk groups. Patients classified in the high risk category had a significantly shorter progression-free survival compared to patients in the low risk category. Our approach demonstrated a high prediction accuracy which outperformed tumor mutation burden and PD-L1 expression. In conclusion, integrative approaches that combine molecular features hold promise for the development of predictive biomarkers of response to immune checkpoint blockade, and larger scale validation efforts are underway to confirm the predictive value and clinical utility of our multiomics approach.